Welcome back to Good Day Atlanta. Just before 9:41 on this Thursday, and an estimated 30 million Americans are living with diabetes. And if you're one of them, you may want to have a talk with your dentist. That's because diabetes can double your risk of serious gum disease. So how can you spot the warning signs and keep your smile healthy? Fox Medical Team's Beth Galvin joins us now with some answers. Good morning, Beth.
And good morning, Elise. And it's really interesting because diabetes and gum disease kind of go hand in hand. If you have diabetes, you're more likely, as Elise said, to develop gum disease. And if you have gum disease, it is harder to control your diabetes. So this is an issue that diabetics and their dentists need to stay on top of.
If you're a diabetic, Inman Park Dentistry's Dr. Alex Rodriguez says keep a close eye on your gums.
And it's a really common issue. If you have diabetes, you're at much greater risk to get gum disease.
The reason? Diabetes drives up our blood sugar levels, and germs like bacteria in our mouths thrive on sugar. So diabetics are more likely to develop infections in their gums and the bones that hold their teeth in place.
And it's not just the superficial above the gum island. We're talking down below the gums, the areas that are harder to reach. What's happening is gum disease essentially is a wound in your mouth. And when you have delayed healing, as you have with diabetes, that wound doesn't go away easily.
As gum disease worsens, inflammatory chemicals can spill into our bloodstream, fueling diabetes. So you want to watch for signs of infection.
Sore teeth, sore gums, deeper, as we call, pockets around the teeth. All these are signs of some gum disease. In a fairly normal person, it's probably just because, well, they weren't brushing and flossing well enough. But for somebody with diabetes, they may be brushing and flossing well, but they're still going to be a little more susceptible.
Rodriguez says a dry burning sensation in your mouth, frequent fungal infections, or mouth ulcers can also be signs of diabetes. And it's something he says his own brother has struggled with.
He told me the other day, he's like, if he hadn't had a brother who was a dentist, he's not sure how much worse it would have been off. I mean, by now we've pulled half his teeth in his mouth because that was the only remedy we had left. It was that far advanced.
The best thing that diabetics can do, Rodriguez says, is work with both their doctor and their dentist to stay healthy.
And if we can control that blood sugar, they can live happy, healthy lives for a long time.
And if you have diabetes, you want to be brushing your teeth and flossing at least twice a day. You need to go see your dentist for a checkup about every 6 months, not yearly like most people do. And watch for those signs, Elise, of gum disease again.
And speaking of those, what are the red flags we need to
So we talked about some of them, but I think the real ones to watch for are sort of bleeding in your mouth or sore gums. Bad breath is also one of them. And then canker sores that really won't go away. You know, every once in a while a canker sore is perfectly normal. When you're repeatedly having them, especially, you know, some diabetics may also have what they call dry mouth, where they're not producing enough saliva. All of those can kind of be red flags that you might have an issue going on there to check with your dentist about it.
Can smoking make this even worse?
Smoking can make it much worse because diabetes lowers your immune system and, you know, makes it harder to fight off infections. Smoking does the same thing, so it's kind of this double whammy. If you have diabetes and you're smoking, that can really do a number on your smile and your oral health and set you up for a lot of problems. So if you can stop, that is a really good reason to.
Sounds like you just have to be a little more diligent.
Yes.
Yeah, for sure. All right, Beth, thank you.
Elise.